I am Danielle Cherrick, and I am a pain management physician here at OrthoVirginia. I work in the McLean-Tyson's office. That's part of the North region of OrthoVirginia, but we have offices all throughout the state. And instead of listing them, I'm going to just direct you to our website to go find a doctor close to you, should you need one. We are going to be talking today a little bit about neck pain and shoulder pain and why the two things are so confusing. So it might seem obvious that this is your neck and this is your shoulder. And so if somebody has pain here, you would say, oh, that's pain that's coming from my shoulder. And if somebody has pain here, you say, oh, that's neck pain. But sometimes when you feel pain here, it's really coming from here. I have a few slides that I want to show you to help illustrate why this happened. So here's slide number 1, where we can see a little bit of the bony anatomy of what I've already discussed, which is that your shoulder is circled over there, and your neck is the bunch of bones that attaches your skull to your body. So if we go to our next slide, that's going to take a little bit of a closer look at the neck. So we can see that we have 7 vertebral bodies in the neck. And then you can see on this slide that there's several yellow string-like things coming from between the bones. Those are the nerves that come from your neck and actually from your spinal cord and feed the muscles in your arms. In addition to providing input into the muscles in your arms, these nerves also carry pain fibers and sensory fibers. And on the next slide, I'm going to show you how the sensory fibers from the neck go right to your shoulder. So you can see in this person facing forward that the C6 nerve, the C5 nerve, and the T1 nerve all encapsulate the shoulder. And then if we look on the back at the shoulder blade region, the C6 nerve, the C7 nerve, and the C8 nerve, as well as the T1 nerve, all refer pain or sensation to the shoulder. This means that if you get a pinched nerve in your neck, you may actually feel it in your shoulder. So now I'm done with these slides. See? Okay, and we're back. And I'm going to give you some tips for how you might figure out at home whether this pain is coming from your shoulder or your neck. So one thing that you can do is you can move your shoulder around. And if when you actually move your shoulder, things really hurt in there, the pain is most likely from the shoulder. If you move your shoulder around and you're not feeling any pain when you do that, the pain that you have there is just staying the same, then the pain might be coming really from your neck. Sometimes if you have trouble moving your neck side to side, and you're like, my neck doesn't hurt, but God, I cannot back my car up as well as I used to, or I think I'm having trouble changing lanes, it might really be because there's something going on in your neck. And sometimes you can actually press on your neck to see if there's a specific tender spot that really hurts. Well, now that you've diagnosed yourself at home, what do you do about it? So number 1, if you can't figure it out, you should 1,000% come in to see somebody like myself or another one of the pain doctors in our practice, or really any neck specialist or shoulder specialist. We're pretty expert at trying to figure out where pain is coming from. Another thing that you can do is, if you've ever seen one of our physical therapists, you can also make an appointment with them and they can try and help you figure it out as well. We also, once we figure these things out, have a variety of procedures that we can do to try and help neck and shoulder pain, including things like epidural steroid injections, which are like nerve blocks, or sometimes we can inject some of the arthritis in the neck, or we can also do shoulder injections to help with any one of those things. So that's my basic advice for how one can really help with shoulder and neck pain. And I think we have some questions, so we can start with those.
Thank you so much. So our first question is, how do I know if the pain is bad enough to come to a doctor? Is there a time period I should wait and see if it resolves itself?
I think that question is a per person type of question. There are some individuals who feel like, I'm just going to see if his pain persists for a week or two, and if not, I'm going to go to a doctor. And there's some people that start feeling pain and feel completely uncomfortable even after a day, not knowing what something is. So I would say, to some extent, use your own judgment. If you feel uncomfortable enough that you're even thinking about whether or not you should see a doctor, the answer is usually see one. But I do want to give you some red flags to look for that would necessitate you seeing a doctor sooner. If all of a sudden you start dropping things, you start feeling a lot of numbness go down your arm, or your muscles are getting weak, that's when you really want to see one of us pretty quickly.
All right, thank you. If somebody's been having a stiff neck for the last few months, even though they've done neck exercises, massages, heating pads, and so on, is that something that can be treated?
Yes. So the first thing we have to figure out is, why do you have a stiff neck? There are many reasons that one can have a stiff neck, but one of the number one reasons is actually arthritis. So just like when people get arthritis in their knees or their hips, and it makes that joint difficult to move, when we get arthritis in our neck joints, it can really make it challenging to move from side to side. Just like there are knee injections and hip injections, there are actually injections that we can do for the arthritis in your neck. It does not get rid of the arthritis. That is one of my most commonly asked questions. It doesn't get rid of it, but sometimes it can make the symptoms from the arthritis far, far reduced.
Thank you. How effective is a selective nerve root block procedure to diagnose which disc is affected?
Oh, that is an excellent question. So just to clarify for our audience, the question is about a nerve root block. Usually when it's saying selective, we're talking about a nerve root block at one of those very specific yellow strings that I've reported about before. So like a very specific nerve. Usually a selective nerve root block is requested by one of our spine surgeons to determine whether or not it's the appropriate nerve that needs to be decompressed. And I've found that in situations where we are already at the point where we are really trying to narrow down a specific level, those selective nerve root blocks can be very helpful.
Thank you. If someone has had an MRI done and it shows that there is an issue in their neck on the MRI, how soon do they need to see somebody?
Well, the thing about MRI reports is that there's a lot of funny language that is on there, and a lot of language that's going to be unfamiliar. So sometimes even when they say things that are severe, it doesn't necessarily mean that one is in an emergent situation. So there are certain findings on an MRI, like if you see things like severe spinal cord compression, that you would want to talk to your doctor about that. But other things like words like severe degenerative changes, those are things that are more chronic in nature, and you really can let pain be the indicator for when you see a specialist. That being said, if you're losing sleep over the MRI results, then my advice would be to see somebody sooner.
Thank you.
Sure.
So if someone is having trouble sleeping on a shoulder due to pain, Could that be a neck issue, or who should they see about that?
So, trouble sleeping on the shoulder due to pain, this is a very good question. There are a couple of reasons why you might have that. The number one reason, in my view, as to why one has difficulty sleeping specifically on their shoulder due to pain is because of what we call bursitis. Bursitis is inflammation of a fluid-filled sac that sits over bones. When that thing gets inflamed, it's like sleeping on a painful water balloon. It feels awful. So my recommendation is to see maybe a shoulder specialist or even a pain doctor like myself, or a sports medicine specialist, sort of a general musculoskeletal person. But I do want to add that sometimes when you sleep, your neck can get into funny positions like this. And then all of a sudden, sleeping with your neck bent pinches that nerve, which sends pain to your shoulder, and then you have difficulty sleeping on it. But most of the time it's from the shoulder. Sometimes it can be from the neck.
Thank you. If somebody has lost some of the curve in their spine at their neck, is that something that can be corrected?
So there's a question. Sometimes people end up going forward, or you're saying it's just your neck has changed in its appearance. I would defer to one of my surgical colleagues about correction for that, but that's not something that we usually see as an indication for neck surgery in terms of like a cosmetic procedure.
Thank you. Do you do radiofrequency ablations?
I do. I do radiofrequency ablations for the cervical spine, so the neck, and the low back, as well as the thoracic spine. I think we were talking before about some procedures that people can do to help with pain coming from arthritis, and radiofrequency ablation in the appropriate candidate can really help with pain coming from arthritis. For those of you that don't know what radiofrequency ablation is, it's a procedure where we sort of block the signal from the small nerves that go to the joints. So not those big nerves that I was talking about, but from the little nerves that go to the joints, we block their ability to communicate with the brain. So even though your facet joints are telling you, I'm in pain, the signal is blocked, so we can't sense it.
Thank you. Do you have any suggestions for people who work at desks and who are using computers or phones all day and who have neck or shoulder discomfort from it? So suggestions of exercises, treatment, preventative measures, anything like that.
So I always encourage, if you work for a company and you are working remotely, I always encourage individuals to explore whether there is an option to get an ergonomic assessment. Somebody either from the company or privately that they can have brought to their home to help set things up for them. Because depending on your anatomy, you may have different needs. There's a few things that you can do or that may help. One is to make sure that your computers are set up so that they're on eye level. You can get an adjustable monitor to allow for that. You also can sometimes get specific keyboards, and your mouse can be specific to mold to your hand so that you have a better ability to have shoulder dynamics that would be more ergonomic or appropriate. The thing is about home setups is that none of them are universal. And really, since COVID, they've become quite eclectic. And sometimes what you found is you never knew you were going to need a home setup, and you have some sort of retrofit home setup that really isn't quite adequate for the level of remote work that you're doing. I would encourage you to find an ergonomic specialist. If you work with a physical therapist, have them give you some home exercises. But what we want to do is start at the ground. So I'm happy for you to have exercises, but I'd want to make sure that your setup at home is one that doesn't predispose you to getting neck pain or shoulder pain or any pain really, or low back, all the pain.
Thank you. How would you treat neck and shoulder trigger points that are causing a great deal of pain?
Oh, well, first we want to make sure that the trigger points are happening for no reason, meaning that the trigger points are just there. It's just like you're tight all the time, and we can do trigger point injections. But sometimes what we actually find is that there is a problem going on in the shoulder or a problem going on in the neck that's causing the muscles around the shoulder and neck to go into spasm, almost protectively. And so first is to make the diagnosis, which I know I've said at least 2 or 3 times now, but that really is the truth. But once we have ruled out any cause for these trigger points, we can do something called trigger point injections, where we inject a little bit of lidocaine and sometimes some liquid Advil, or very sparingly sometimes some steroid to help calm down those trigger points.
Thank you. And speaking of steroids, that's our next question. Someone has neck pain that's been helped by prednisone, but it comes back when the prednisone is done. And the person also has tingling in their chest going up to their ear. Could that pinch nerve?
Yes, absolutely. It's a little bit atypical, like this chest to ear pattern, but it's certainly something that we would want to look into, especially when pain goes away from prednisone. That means there's some type of inflammation that is causing that pain. We want to figure out where that inflammation is coming from.
Thank you. If someone broke their shoulder a while ago, about 18 months ago, but it still bothers them and they have trouble using that arm, is that something that they should have surgery for? Should they go see a surgeon? Should they see someone like you? How should they get treated for it?
Well, first of all, I'm really sorry that you're still having pain after 18 months and having difficulty using your arm. That's just, that is not a situation that anybody wants to be in. Secondly, I think seeing a shoulder surgeon could certainly be a start. Our shoulder surgeons here and our physicians here, we know that our first job is not surgery. Our first job is figuring out how to take care of the patient best. And sometimes that's surgery and sometimes it's conservative treatment, but a lot of times it's figuring out why you hurt. All the time it's figuring out why you hurt. And sometimes you might need some extra imaging. So somebody like myself or one of our sports medicine doctors who are non-surgical could certainly help with something like that. But also any one of our shoulder surgeons could also evaluate the status of the break and help put you on the right path.
Thank you. How soon after one pain injection can you get another one?
It really depends. It depends on how much better you get after the first one, and it depends on the type of injection that you had. And then sometimes, frustratingly enough, it can depend on your insurance. But let's say that insurance wasn't a factor at all. Usually, if we're doing injections in some type of series, or you're requiring 1, 2, or maybe even 3 of the same type of injection, we would not want to do them any closer than 2 to 3 weeks apart.
Thank you. Is there an upper age limit or a lower age limit on these pain treatments?
An upper age limit, no. I did have somebody in the office the other day who was 104, so they hold the record right now. But I welcome any 105-year-olds to come. A lower age limit, I would say, yes, we really don't want to be doing these injections in teenagers or in individuals who are quite young, unless there's extenuating circumstances.
Thank you. Will physical therapy cure a pinched nerve?
Oftentimes, yes. Yeah, there are certain exercises and certain physical therapy treatments that absolutely can make pinched nerves feel better. In fact, oftentimes the people that I see are people who have done some physical therapy and it's not working. I think there's plenty of people who have seen physical therapists that I never even see because the physical therapists get their pain better.
Thank you. Someone is currently having Botox shots for dystonia in their neck, and they're wondering if that is also related at all to their shoulder, or if there's something else they should be doing for it.
So Botox for dystonia is an excellent treatment. It's not one that we offer here, but I do send people to get that treatment. I refer out for that often. The question of whether, if they are having shoulder pain, in addition to the limitation in range of motion that they experience because of their dystonia, then that shoulder pain does need to be worked up. If you're not having any pain in your shoulder, but it's unlikely that anything going on in the shoulder is causing the dystonia.
Thank you. You were talking about nerves from the neck going down the arm having pain. Mm-hmm. Does it work the same way in reverse? So if somebody is leaning on their forearm and they have pain that goes up towards their neck, what is that from?
Oh, so this is a great question. What you are speaking about, and that was very perceptive of you to recognize the directionality of my talk. You are correct. Pinched nerves tend to send pain down. The pain, when somebody has pain that starts in their fingers and goes back up, or starts in their arm and goes back up, a lot of times that is from what we call a peripheral nerve. So for example, in carpal tunnel, it tends to be that the pain starts in your fingers and it goes backwards. And sometimes you find yourself wringing your hand out in the middle of the night. But most of the time when I ask a patient, does the pain start in your fingers or does it go into your fingers? If they tell me it starts in their fingers and goes backwards, then I'm often thinking, oh, they might have carpal tunnel, or maybe they have both. Now, you asked specifically about the forearm. The forearm, there's a nerve here called the ulnar nerve. And that nerve tends to go to the pinky. And sometimes when you rest your arm just right, you can get that nerve, and that nerve can sometimes send things back up. If you're having that a lot, and it's really irritating you, I still would recommend seeing one of us to make sure, especially from the forearm, but just generally. But in general, when things are going backwards, it's not from the neck, but it's from a nerve being compressed locally.
Thank you. If someone had shoulder pain that went away, but that arm still has less control, less precision when they are lifting it upwards, is that a pinched nerve, a muscle tear?
That is an 100% need for an evaluation. That's the kind of thing that we need to tease out on a really dedicated, specific physical exam. It's hard to know whether, and not only whether there's weakness, but if there is weakness, why there's weakness. So your question is correct. I do not know, based on that description, where it would be coming from, but I'm fairly confident we could figure it out.
Thank you. Should someone go see a physical therapist or a chiropractor?
Whoa, that's a loaded question. So I think it really depends. I have some great chiropractors that I like, and I have some wonderful physical therapists that I like. And I really find that they do quite different things. My general preference is that if you don't have a diagnosis yet for what's causing neck pain or low back pain, that we figure that out first before you have any manipulations. But and in that case, I think, PT might be safer, but we really want a diagnosis before we send to any specialist who's going to help you fix it.
Thank you. After you have pain injections, how soon do you start physical therapy?
Oh, so I sometimes have patients that are already in the middle of physical therapy or haven't started yet. And I don't really have a specific time other than to say that I prefer at least that within a week's time period, at a minimum, they're having their first physical therapy session. If we decide that PT is what is needed at the time. It's not always necessary, but in those cases when we require PT or we think it would be beneficial, having an injection and then having PT within 1 to 2 weeks later would be really appropriate. I do get a question a lot, can I have physical therapy the same day as my injection? And the answer is yes, you can. So I would never want to hold physical therapy for one of our procedures.
Thank you. We had dystonia mentioned in an earlier question. Can you just give a brief explanation of what it is?
So dystonia is a contraction of muscles that leaves your neck in a very specific direction. Another term for it can be called torticollis. So you sometimes can walk around with your neck kind of twisted like this. It's very different than a stiff neck scenario. It sometimes doesn't even involve painful muscle spasm as much as it involves a lot of muscle contraction, such that it deviates your head in a specific way.
All right, thank you. That is all the questions that we have time for today. We didn't get your comment answered that came in during the live. We will answer it later in the comment section. Dr. Cherrick, would you like to close?
Thank you all for tuning in. And also, hello, Sammy and Jake. Those are my kids. I promised I would mention them. So hi. And thank you all. If you ever need me, which I hope you don't, because I hope you have a pain-free life. But if you do, you can come and find me at McLean Tyson's.